Stroke is caused when there is blood supply to a particular part of a brain that's cut off, either because there is a clot blocking the blood vessel, or if there is a bleed which is leading to loss of blood supply to a particular area of the brain. Stroke is a very common problem all over the world. It is the second commonest cause for death and fourth commonest cause of disability all around the world. The chances of getting stroke is increased by the presence of diabetes, hypertension, people who smoke, high cholesterol, lack of exercise, obesity. Now, acute stroke is called brain attack. Just like heart attack, brain attack is an emergency. Now, people with acute stroke need to come into hospital as early as possible so that we are able to re-establish this blood supply, or at least reduce the damage that is happening to the brain because of the compromised blood supply. Now, acute stroke, as I told you earlier, is of two mechanisms. If there is a clot that is blocking a blood supply and causing a stroke, when person comes to the hospital within 3 to 4.5 hours, we are able to give a clot busting medication called TPA or Altiplase, which when given within 3 to 4.5 hours can reverse the block and restore blood supply, therefore reducing the area of brain that is damaged because of the stroke. As a result, the disability that comes with the stroke is reduced to a great degree. But of course, for this, recognition of stroke as early as possible is vital, and getting to hospital and seeking medical attention is absolutely essential for the success of this treatment. The second type of stroke is caused by hemorrhage. Now, in this type of stroke, the edema which occurs as a result of the bleed causes more damage to the brain and increasing the disability in these patients. In these cases, we should again get to the hospital as early as possible, reduce the edema that occurs with the bleed, prevent and control the blood pressure, which most of the times is increased, leading to the hemorrhage. So whether the stroke is caused by a blood clot or hemorrhage, it is absolutely essential for the patient to get to hospital as early as possible and seek medical attention. Now, an easy way to recognize stroke, you can use a very simple tool called FAST. Now, it's a mnemonic which is used widely across the world. Here, F stands for face, which means if there is any asymmetry to the face, immediately note it. A stands for arms or limbs. If there is weakness of the limb on the left or right involving upper or lower limb or even both, again it's a sign of stroke. If there is a speech impairment or problem, then again this is a sign of stroke. T stands for time. Time is brain. So as soon as you recognize that a patient is having stroke, you have to rush the patient to the hospital. So FAST is the mantra that you need to remember for stroke and for early management of stroke. Thank you.